you already done pulse.
I'm going to just quickly go over vitals.
Okay.
Ready? Okay, so next I'm going to move on to vitals. So I took the pulse earlier. I said the pulse was 55. I am going to listen to breathing. Would you mind just sitting up for me? Take a deep breath. Okay, so it does sound like there's some tightness in the chest. It sounds like she's straining to breathe. I can hear a little bit of wheezing. So I'm going to take the blood pressure. Blood pressure is 120/80, so that's good. The respiratory rate is 12. She's breathing kind of heavily. So next I'm going to do my field impression. So my field impression of the patient is that she has an allergy to peanuts. She ended up ingesting a peanut and she's having an anaphylactic reaction. So I am going to call med control and see if I can administer her EpiPen that she says she has. So, hi, my name's Lydia. I'm an EMT. I have a 51-year-old female patient who has an allergy to peanuts. She just recently, an hour ago, ingested a brownie that she suspects has peanuts in it. Her blood pressure is 120/80. Her respiratory rate was 12. Her pulse, I said, was 55. When I listened to her lungs, they were labored and sound like that she was straining to breathe. Her mouth is swollen and she is feeling some tightness in her chest. She was prescribed an EpiPen and has been to the doctor one other time for a reaction that was very similar to this. I'd like permission to administer or help her administer her EpiPen intramuscularly into the outer thigh. Okay, so med control gave me permission. So do you have your EpiPen on you?
Yes.
Okay, do you know how to administer it?
Yes, I think so.
Okay, so just as a reminder, you're going to administer it right here on the outer side of the thigh. And you're just going to push it in and hold it in until all the medicine comes out. Okay, so we have administered the EpiPen. We are going to reassess every 5 minutes. I'm going to take blood pressure, pulse, respiratory rate,